Figuring out when you ovulate with PCOS can be more difficult, obviously, because our cycles are irregular and they just like do what they want. Now, most of the time, this has its roots in like higher androgens and like insulin resistance, which is like screwing up our cycle, making our cycles really long. So, like 40 days, 50 days, 60 days. And the reason why it's long is because our bodies are just failing to ovulate. So, your body might be trying to ovulate and then it doesn't, and then it might try again and it doesn't. This just makes your cycle really long because once you ovulate, your period will come within like 2 weeks. Now, how I track my cycle with PCOS is that I will track my cervical mucus and my basal body temperature. And I use these to like help prevent pregnancy currently as well. Because when your body is working up to ovulation, that follicle is maturing, it's growing, and it's releasing higher amounts of estrogen. That higher amount of estrogen causes you to have more cervical mucus that you will notice. So once I see that, I can tell that I'm in my fertile window, I'm close to ovulation. And then I start wearing my Oura ring to bed to tell me if my temperature increases or not. Because if your temperature increases, that means ovulation occurred because your body's now making progesterone, and that progesterone raises your basal body temperature or like just shifts your temperature a little bit higher. The Oura ring itself doesn't measure BPT, but it does measure like your average temperature while you sleep, which is also very helpful, especially if you kind of have like night wake ups and things like that. With PCOS, if you see like you have an increase in cervical mucus, but your temperature does not rise, you didn't ovulate yet, so maybe you have some dry days coming up and then you see the cervical mucus again. So with PCOS, we see these cervical mucus patches as our body tries to ovulate, but it doesn't. So that's why it's really important to use the temperature along with tracking your cervical mucus if you have PCOS.